Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we have a special guest, Dr. Kevin Toman, and we're talking about extending pet lifespans through longevity science. So Dr. Kevin, thank you for joining us today.
Thank you very much for having me, Brittany. I look forward to chatting with you.
Yeah, so tell us a little bit about yourself and your vet background.
Well, I graduated from veterinary school back in the dark ages, back in 1986. And over the succeeding three decades, I practiced both in California and in a kind of a rural area of Colorado. And I ended up doing a lot of emergency work, which led to a real passion around orthopedics, cancer care, and the care of these chronically painful pets. And by definition, a lot of those pets are seniors. And so, as you and I spoke about just a moment ago, the reality is that these senior pets, be they dogs, be they cats, they need an awful lot more help than traditional veterinary care has been able to provide for them. And so I had the luxury of selling my practice at one point in time. And in the last 10 years, I've devoted myself specifically to that intersection, that Venn diagram of veterinary medicine looked at maybe just a little differently, a little more comprehensively, and longevity science.
Was there a catalyst that led you down the road of longevity and lifespan extension? Like, was there a particular dog or a particular case, or was it just kind of this recurring theme you were seeing that led you down this path?
A little bit of both. And I would confide in you that there were two personal experiences that really prompted my interest, first in integrative therapy, and then secondly in the comprehensive care of cancer patients. So when I was about 46, I was diagnosed wrongfully, luckily, as it turns out, with myeloma, which is a fatal fatal cancer across species lines. And as it turns out, I self-referred to the Mayo Clinic and went through a bunch of hoops down there and was told that I actually had a precancerous condition. And so my logical question as a healthcare practitioner is, how can I prevent that malignant transformation from occurring? And they said, well, there are no drugs that can do that, but there is a spice called curcumin that can. And so that was kind of the door opening into my integrative interest, because I was using it very specifically and very selfishly for me. But what I learned early on is that the very same principles of integrative therapy apply whether you have 2 legs or 4. And so it became a hallmark of my veterinary practice. And the second component to your question is just that, as we mentioned a few minutes ago, I loved a golden retriever named Brooke with all my heart. Mm-hmm. And as many golden retrievers do, she developed cancer. And I felt very limited by the options that I was given, the chemotherapy, the fairly painful and side effect laden drugs that we were using at that point in time. And so that really prompted further interest in not only integrative therapy, but also the longevity science component of it. The drugs like rapamycin or acarbose, or the ketogenic diets that we mentioned a moment ago, that offer a more integrated, more holistic approach to cancer management. And maybe we're not going to be successful at the end, but there are 2 advantages that I can very definitely speak to. One is the fact that pet parents want to know that they are doing everything they can for their pet, irrespective of economics, irrespective of finances. You want to know that you're doing everything you can for your pet. And if you and I, by using an herb or a diet or a prescription drug, by golly, if we can offer them 1 day or 1 week or 1 month of additional quality of life, I'm all in.
Yeah. Yeah, I think the focus here is, not only living longer lives, but a better quality of life as well. I think
Absolutely.
There's really, kind of 2 parts to it. And I think as a vet, especially seeing senior dogs, I know that you're always focused on that quality of life. It's like, sure, they're older, but what's their quality of life?
Yeah, that should be the ultimate litmus test for all of us. How can we protect our pet's quality of life? And so it's the difference between lifespan and the newly coined term of health span. Because the
Hmm.
longer you and I can help our pets lead that active, lead that healthy life, that's an investment well worth making.
Yeah. So I think there is certainly a longevity gap in pets currently. I mean, we are seeing dogs and cats living possibly shorter lives, sicker lives. I mean, you just see every day someone else's pet being diagnosed with cancer or an advanced form of a untreatable disease. And why do you think that is with all of the medical advances that we have in 2026?
Well, I think that there are two components to it. And the first is the fact that veterinary medicine has gotten an awful lot better at detecting these problems. So when I graduated from veterinary school back in 1986, I had no idea, for instance, what a dental X-ray machine was. We did not have, so I'll speak very directly to that. University of California at Davis, pride itself on being one of the very best veterinary schools around. I had zero classes in pet dentistry when I went through
Wow.
school. And now, it's the subject of a year-long course with internships and residencies. And so I think that, and I use dentistry as an example, but the reality is that just the ability to do a CT scan or an MRI on pets. And I fully understand the economics involved, but our diagnostics are so much better than they were that perhaps a component of what you've spoken about is just our ability to actually diagnose these things.
Hmm.
Now, the second component to you, I mean, this is something that you and I could discuss for several hours over a beer or a glass of wine, and that is why does there seem to be an increase in chronic diseases in both humans and pets? And I don't. I'm not going to get political, but I am a believer in global warming, and I am a believer in the fact that we're seeing these microparticulates, the microplastics, throughout our not just diets, but everything we drink, every place we swim or whatever the case may be. And so I do believe at the end of the day that the combination of diets and our current lifestyle, our modern lifestyle, are absolutely responsible for an increase in some of the chronic diseases that you and I are familiar with.
And how do you think early intervention can change these long-term outcomes? How can we flip the script? You and I talking today and giving pet parents something to think about.
Well, almost any disease is vastly more treatable at an early age. I mean, very few cases of a melanoma or a mast cell tumor develop as full blown disease. Usually, they start with a bump no larger than the size of a pencil lead or a pencil
Hmm.
eraser. And if you and I catch that bump early in the game, looking at skin cancer in particular, the solution, a permanent solution, can be very simple. Whereas after a cancer has spread, then it becomes a much more problematic issue. But the reality is that across species lines, whether you're talking about cats, you're talking about dogs, you're talking about humans, let's put those early diagnostic tests to work because if you and I can catch diabetes, for instance, in a dog, well, and this is something that's eminently practical now with recurrent blood tests. We don't even have to wait till a pet's blood sugar levels get out of normal range. If you and I see a trend of gradually increasing and repeatable blood sugars, let's start that dog on a ketogenic diet. Let's start that
Hmm.
dog on supplements like berberine that could help normalize that pet's blood sugar. Let's start that dog on prescription longevity drugs like metformin or rapamycin or acarbose, all of which are proven to help normalize the metabolic effects of diabetes. And so we just have a lot more bullets in our gun, so to speak, if we catch a disease early in the game.
You know what I found interesting starting this podcast is, oh, and I can't remember the statistic. You might know it. It was either 30, I think it's 33% of pet parents don't know that their pet can get cancer. They did not know that it existed, that, their dog could ever even get cancer. And that was such a crazy statistic to me. And I want to say that that's correct. Someone listening will probably correct me when this comes out. But just the fact that that many people had no clue that their pet could get cancer. And so in their mind, they're probably not even thinking about the repercussions of certain lab work or x-rays or, whatever it might be. I mean, do you see that much in practice? People who if they don't know that their dog could get cancer. They don't know about diabetes. That's another one that I've been learning. A lot of people didn't know dogs could get. I mean,
Yeah.
how often do you see that?
All the time. All the
Really?
time. Yeah. And so I would broaden that discussion, not just from cancer and diabetes, but into arthritis, for instance. And
Mm,
I just returned from an internal medicine conference where there's pretty good science, pretty good study that showed 40% of pets over 4 years old have arthritis.
yeah.
And how many times have you, or how many times have I heard the diagnosis by a pet parent? Oh, they're just getting old. That's
Yes.
why they're having difficulty getting up and going down the stairs. That's why they're slipping and falling. And the reality is that just like us humans, getting old is not a disease. Getting old is not responsible for these things. And so if a pet parent sees their pet slipping or falling or eating, or in the case of diabetes, peeing more frequently than normal. The reality is that these are telltale signs that you and I can use to head this problem off at the pass, but it's
Hmm.
predicated on an early diagnosis. And so we've actually established very recently a business component looking at functional health testing, modeled on the functional health testing currently available in the humans, where you and I might draw blood 2 or even 3 times a year for biomarker testing in these pets. And again, we're not looking for normals versus abnormals. You and I are looking for trends because those trend lines can many times tell us, hey, there's something going on here. There's something that we need to look at to solve this before it becomes a clinical and permanent disease.
Hmm. That's a great point. And even a lot of humans could use that. You see your A1C
Absolutely.
trending up, and it's like, we should probably do something about that
Yeah,
A1C.
yeah, yeah.
Your thyroid hormones, they start to trend a little funky, and you're like, oh, should do something. But
Yeah, yeah. And the question though is just as with veterinary medicine, you have to find a mentor. You have to find a caregiver who really gives care, somebody to hold your hand in that process. And that's one of the things that I take great pride in terms of my approach to veterinary medicine. But the reality is that almost every community across the United States has a good veterinarian who can help you navigate that trip. But without that help, it's difficult sometimes to try and simplify things down to the truth when you're looking at Dr. Google or Dr. Chat GPT.
yeah. Now let's talk about the longevity models. 20 to 30% longer lives with this longevity model. And what does that mean to extend a pet's life by 20 to 30%?
Well, I mean, obviously, you can approach that from an emotional perspective. And if you and I can extend the life of your Palm or my golden retriever by a year or two of healthy living, how much is that worth to us? And
Hmm.
to me, at one point in my life, I would have said it's worth almost anything to me. And so the you may have seen with your knowledge base, there's a very telling graph. If you think back to the old high school and college days of looking at XY graphs, the traditional model of aging has been a gradual decline in quality of life with time. And our goal instead is to maintain that quality of life for as long as possible and then have a more abrupt loss of that quality of life right at the very end of a pet's existence. And so, again, I think that if you and I can use longevity drugs, if we can use supplements and diets and lifestyle and proper veterinary care to extend that pet's life by a couple of years, it just means the world to me.
Hmm. Yeah, I agree. I would spend any amount of money. Any of the vets that currently have my credit card on file know that to do anything for my dogs.
Yeah.
There are
Oh,
about 7 or 8 of them right now that just have multiple
okay.
credit cards stored. So I hear you on that. And
Yeah.
I feel like right now there's a lot of hype and a lot of misinformation about longevity, right? And so, kind of like you were saying, we can't just take everything we see on Dr. Google and Chat GPT. And so, what's kind of your advice for separating some of the false narratives or the hype from the realities of longevity medicine?
Well, I think the first thing, my first piece of advice is going to be somewhat counterintuitive, and that is that as you and I think are probably overly prone to do your own research. Learn not just from your veterinarian, but spend the time, spend the the money if need be to really learn about what your pet's diagnosis is, what their prognosis is, what their genetic risks are. For instance, with POMs, you're very prone to heart disease, you're very prone to bronchitis, to lung issues, and dental disease. Those are big three for a POM owner. For a golden retriever dad, like I used to be, you have cancer and orthopedics and allergies. And so these are tests, these are potential health issues that going in, whether even as a 3 month old or a 4 month old or a 1 year dog, that you're going to have to deal with most likely at some point in your life. And so use your time, use your knowledge, use your resources to educate yourself about these things. And then, I will stand on the thought that you need somebody to walk that path with you. You need somebody to hold your hand and walk down that path, whether it be me or another longevity science-based veterinarian. But traditional veterinary care, and I'm going to paint it with a pretty broad brush, but when you are seeing pets on a 20-minute interval, one time annually for an exam, it is very difficult for the average veterinarian to give you any meaningful information around longevity science. And so because I turned 66 just last week, I would tell you that mortality means more to me than it did a few decades ago. And so I can tell you that there are any number. Oh, here's my golden retriever, my current golden retriever Annabelle, making a guest appearance here. There are any number of podcasts, Peter Attia, Andrew Huberman et al., looking at very honestly at longevity science. And the key is to synthesize what you learn from 3 or 4 or 5 of these experts, 3 or 4 or 5 of the veterinarians that you spoke of, and try to develop a plan that makes sense to you longer term.
And let's talk about how are we blending traditional, integrative, and longevity care? How can those kind of work together? What does that look like in practice for a pet parent?
Well, I would suggest to you that there are actually 5 ways that you and I could take a very systematic approach to pet longevity. One is diet, second is lifestyle, third is veterinary care, fourth is supplements, and fifth is actually prescription longevity drugs. And I would tell you that in my experience, people want to take the shortcut. They want to skip straight to the prescription longevity drugs. And there's logic to doing so, because I could show you pretty compelling evidence that rapamycin, as an example, has been shown to extend lifespan in every mammal species studied to date by up to 14%. But that's just one intervention. And the reality is that if you as a POM mom choose to use rapamycin without caring for your girl's dirty teeth, without caring for the significant periodontal disease and the pain and infection that it causes, or if we again use diabetes as an example, I mean, the reality is that we have to look at the trees, not the forest, and so. When I speak of veterinary care, I speak of early diagnostic testing. When I think about diets, I would tell you that I used kibbles on my dogs for probably 50 years of my life. But there are substantial studies out there that show that really the average kibble diet is not nearly as effective, not nearly as healthful for a dog as a better quality kibble or a home cooked diet or some of the premium store-bought diets that you and I could speak to. And from a lifestyle perspective, Brittany, well, gosh, if you can avoid having a golden retriever go up and down the stairs all day long, if you can avoid having a POM come running around the corner and slip and fall every time you get home from the grocery store, they will live longer. And so it's not just one approach. The reality is, just like your health or my health, the more different approaches that you can take. I'm mimicking a kind of a sunburst effect, because the reality is that good quality medicine, good quality longevity science is dependent upon having a bunch of different approaches rather than just one.
Right. That makes sense. I mean, you can sit here and feed your dog a particular food thinking it's the best and give them these supplements. But if they have arthritis and you're letting them jump from the top of the couch to the bottom of the couch repeatedly every single day, how well is that food working? Because quite frankly, you're working against it by letting them do that. So, with our POMs, their patellas just go wherever they want. One of our dogs had a new knee put in when he was 2, actually. So we have steps to our couch, we have steps to our bed, and then we've taken it a step further for our senior. We have motion sensor lights so that if he wants to use the steps and not fall, it's a little extreme, but I do think it is helpful.
When I die, I want to come back as one of your palms.
You do. They get massage, acupuncture, underwater treadmill, laser, you name it. It's excessive over here. So I'm hitting it from all angles. We are integrative over here. We've got the traditional medicine, we've got some kind of that Eastern medicine, and like you said, it's definitely doing your own research, because Dr. A and Dr. B might tell you something different, and maybe you need to go research. What did Dr. A tell me? What did Dr. B tell me? What makes sense for me and my dog? And that might even be like, what fits my lifestyle? What fits my budget? I mean, there's just so many different components when looking at it.
And one of the ways I'd mention, this is, I think, an important thought for many of your listeners, and that is, people ask me all the time, what are ways that you can tell whether you have a good veterinarian or not? And one of the ways that you can tell whether you have a good veterinarian or not is the ability to have them sit down on the floor, onto that chair, or whatever, on the bench, and really discuss something with you. And when you, Brittany, ask your veterinarian why does my dog need this vaccine? Or why does my dog need this blood test? If you get a because answer, then the reality is that you're probably in the wrong veterinary clinic. But if you get a veterinarian who will sit down with you and say, well, listen, this is what science shows, this is what I would do with my own pet, this is, what Brittany's POM's medical history is like, and so therefore this is the way I would approach things, then you've likely found yourself a really good veterinarian who can help you navigate the shoals of your pet's health trajectory.
Mm-hmm. Yeah, I think that's great to think about, because it is hard to paint the picture of a good vet. And I think so many people just go to someone, and then I think a lot of people feel stuck. They're like, oh, well, this is who I go to. This is who it is. And it's like, no, you can shop around. I mean,
Absolutely.
You can set some different appointments and have some, it might take a little bit of money and time, but again, that investment, I think, is worth it.
You know what? Finding the right partner in crime is the very best investment you can make.
Yeah, for sure. Let's talk about practical strategies. And so, what are just a few, 2 or 3 daily habits that you think influence longevity the most?
Well, I'm going to preface it by saying that current science, anyway, suggests that inflammation writ large is one of the single determinants of aging. And so whatever you and I can do to reduce inflammation in our dogs will, according to current science, add to the years that they spend on Earth. And so when I look at that, I would divide it into demographics of dogs, realistically. If you have a dog under 20 pounds, the single most common threat to their health, in all candor, is dental disease. Mm-hmm. And dental disease cannot be solved by non-anesthetic dentals. The only way to solve it is by knocking pets out so that you and I can take x-rays of every tooth in their body, just like they do for us humans. On the other hand, if you have that golden retriever that I spoke of, we bounced into the picture here just a few minutes ago, the reality is that allergy medicine and orthopedics play a much larger role for them than does dental health. Mm-hmm. And so the things that I would point to then are ways that you and I can reduce inflammation in our pets. And to give you several examples of that, I do think that dental care is a large part of every pet under 20 pounds deserves quality and repeated dental care. Mm-hmm. I think that if you have a golden retriever who is itchy and scratching all the time, or is bothered by a bad set of ears, we need to solve that now. Now we can use allergy testing to determine exactly what your pet is allergic to, and in about 2/3 of cases, desensitize them before that lifetime of chronic inflammation occurs. One of the things that I would mention with wholehearted enthusiasm is trying to understand when to use a vaccine that is suggested by your veterinarian and when to not use a vaccine that is suggested by your veterinarian. Here's the deal. When I graduated from veterinary school back in 1986, I was told that every pet needed every vaccine once annually.
Mm-hmm.
But the reality is that unfortunately, that's a pretty good way to make money, but maybe it's a way also to do a disservice for our pets. Because if I told you that vaccines are designed to create inflammation, and oh, by the way, what you and I are trying to do is to minimize inflammation throughout a pet's life, well, why don't we take a more realistic and custom approach to the vaccines that a pet should be given? And so if I look at dental care, if I look at structured and critical use of vaccines, and then trying to eliminate allergies or orthopedics along the way, I think you got a really good basis for longevity.
Mm-hmm. I just had a conversation with someone, I think it was last week, on dental care. And they were like, well, I want to get my dog's teeth cleaned, but I don't want him to go under. I think I'm just going to pay for someone to kind of like scale him. And I'm like, well, I hate to say it. I think that's a waste of time and money. I said, don't get my opinion, ask your vet. But at the end of the day, that's not really a true cleaning getting in there. And what I've always understood is dental disease or even that plaque buildup can get to their brain so quickly and can cause such terrible infections that things can go sideways very fast.
Yeah, and I don't want to, beat this to death for your listeners, but the reality is that fully 3/4 of many teeth are buried beneath the gums. And that is where the actual bacteria live. That's where the infections live. And so the only way that you and I can diagnose that, I mean, you can have a tooth, the exposed tooth that looks just spotless. And listen, for a decade in my veterinary career, I would look at a pet's teeth and say, oh, heck, they don't need a dental cleaning. And then I realized with education how wrong I was, because you can have teeth that just look spotless when they're exposed, but underneath the gums, you'll find evidence of chronic periodontal disease, chronic infections, or tooth abscesses, which mean to you and me two things. One is the fact that your pet is sore every day. Every day they have a toothache. And we all know how bad that feels. And the second component is that, as you suggest, the infection associated with periodontal disease, it's been proven in humans to decrease your life by up to 15%. Now, that can be up to 10, 12 years in humans. We think the same percentages apply in pets because the bacteria from your mouth get spread to your heart, the valves in your heart, they spread to the brain, spread to the eyes. So you're absolutely correct.
Are there any early warning signs, and just generally, if you could just think of a couple, that should be red flags to pet parents to say, hey, I need to go to the vet or I need to talk to someone about this?
Well, I would, if I were to look at the things that you and I have spoken about in terms of symptoms of disease, I would say bad breath. I would say a chronic itch, a pet that itches or shakes their head on a continual basis. And I would say a dog that limps more than 3 or 4 days in a row. All of those things are indicators that inflammation is shortening your pet's life.
Mm-hmm.
Now, and we can segue back to talking a little bit more about diet or lifestyle changes as well. But if you're looking for symptoms that would mandate a trip to the vet, those would be the first three that I would be thinking about.
I think those make sense. I think especially the itch one. So many people see an itch and they just throw Benadryl at it for a while,
Yeah.
and they're like, I think that's good. That'll get me by. So I think that's very helpful advice.
Yeah, and so let me just address that really quickly, and I apologize for taking this detour, but the reality is that Benadryl has been shown to work in less than 10% of dogs. And the Zyrtec, interestingly, is about 3 times more effective than Benadryl is. And the dose for your listeners is 1 milligram per kilogram of your dog's body weight given once daily. So 1 milligram per kilo, or 2 milligrams per pound, basically, given once daily. And that'll give you a heck of a lot better chance at solving your pet's itch than the old-fashioned Benadryl.
Good to know. Yeah. Benadryl doesn't work for me either. I'm like one of those, the 90% of dogs it doesn't work on. That's me. So earlier you mentioned health span. So we've got health span and lifespan. Can you explain those and tell us why health span matters as much as lifespan?
I could use my mother as an unfortunate example. And I love my mother. She's not with us anymore. She lived, she was a smoker. So let's start by saying that. And she lived to the age of 82. That was her lifespan, was 82 years. But the last 3 years of her life, she spent in bed because of bone cancer that had been caused by her smoking habit, by her smoking addiction. And so that paints a very clear and very vivid difference for me because she may have had 79 years of health span versus 82 years of lifespan. But to me, to the people that loved her, the reality is that we would have given anything to extend that health span. So, can your dog get up? Can your dog go to the park? Can your dog play with you? Does your dog show an interest as you move around the house? Do they follow you? The reality is these are all markers of an engaged and healthy and happy pet. But too often in my veterinary career, I have seen pets come in, being held or being bundled up in a blanket, and the reality is that they say, "Oh, my pet hasn't been able to get up for 3 months or for 6 months." And I've been feeding them in place, and every day I clean up the floors, with the poop and the pee, and that's no lifestyle for either a pet or for a human. And so, my goal as a longevity veterinarian is really to maximize that health span, and whatever I can do by with the 5 levers that you and I spoke of a little bit earlier, to increase that health span, and then when we do get to a point of decline, let's manage that decline, make it as quick and as peaceful and as painless as possible so that we can extend our pets to the happiness. So we extend our pets' happiness is really what it boils down to.
Right. And let's talk about the future of pet longevity medicine. So where do you think things are heading as far as longevity science, or what should we be looking forward to? Or what should we even be weary of? I'll even throw that in there because I think that's also another caveat is with the good comes some bad. So I'll even toss that in there.
Absolutely. And I'm guessing that many of your listeners understand that the supplement business for both humans and pets is rampant with misinformation and with self-serving claims and the like. And so when I look at one area that I'd love to get cleaned up a little bit more, it would be supplements. And that's low-hanging fruit. But in direct answer to your question, I would like to think, Brittany, that over the next decade, over the next 20 years perhaps, that longevity science will be a recognized specialty within the veterinary world. Right now we have radiologists, and we have internal medicine folks, and we have dentists, etc. But the reality is that there's no longevity science certification that can blend all the different all the different means of keeping a pet healthy into under one roof. And so I would love to think that there would be a longevity science veterinary curriculum that would be established that would allow somebody to take their pet to somebody who specializes in this. But I think that if you take a step back from a longevity science specialty, wouldn't it be nice if the use of longevity drugs became more widespread so that every veterinarian understood the pros and the cons of their use? Wouldn't it be nice if veterinary medicine were able to develop a more affordable model? Let me repeat that, a more affordable model of diagnostic testing so that people don't have to spend $300 to $400 on their pet to get a blood panel that has a urinalysis associated with it. But maybe that same blood panel could be $70 or $80, and that would enable us to do those panels more frequently and perhaps intervene in those diseases a little bit earlier in the game. And the last component, and this is something that's near and dear to my heart because I'm a relationship builder, and somewhere along the way, veterinary medicine lost that.
Yeah.
Whether it be COVID, whether it be the fact that the demographics of the veterinary world are changing, and veterinarians don't make as much money as some of the competing professions, but it's very difficult to get to know somebody in a 15 or a 20-minute appointment. And so, as a relationship builder, I'd like to get back to the days when. Yeah, and you speak of going into the future, and I'm going to crawl back into the past here. I think there is a business model that would lend itself very well to pet longevity, and that is to have a family doctor again. Have a family veterinarian who can follow that pet from early age through the rest of their life. And you're not seeing a different veterinarian every time you go to a veterinary clinic.
Mm-hmm.
So I think the increase of technology, I think diagnostic testing and coming down in price, and maybe a return to that concierge or that family doctor model would be wonderful ways to think of the future.
Yeah, I think that would be fantastic. I hope that's the direction we're going. We can only cross our fingers, right? So, okay, I know I kind of asked you for some different habits and changes. Anyone listening today, if you could give them one longevity habit to implement or to start doing, what would it be?
The one thing that has been proven beyond a shadow of a doubt for humans and for pets, if you want your pet to live longer, feed them less. There's been a very interesting study, and any of your pet parents can Google, any of your listeners can AI the Purina diet study. And what they did is they took Labrador Retriever litters and they divided them in half. And one half of those puppies they fed a typical diet, quote normal standards, and the other they fed at 2/3 that ration, so that they were relatively calorie deprived. And the puppies that were genetically identical but fed less lived up to a year and a half longer than their brothers and their sisters. That's been amply proven in human medicine as well. So if you want to live longer, eat less. And I hate to make it so simple. Eat less, eat better. You and I, the same things that you and I try to adhere to on a daily basis apply to our pets. If you feed them 20 to 25% less, they will likely live 10 to 15% longer without spending any money at all.
Yeah, and actually saving money. So
Hmm.
that's a great point. When two of my dogs transitioned to raw food, it seemed like so much less, but they're more active, their coats are better, their teeth.
Absolutely.
I could go on and on. It was crazy when we transitioned. So I was like, I don't know if they're getting enough, you know? Kind of like when parents are feeding their kids and they're like, all right, clean your plate. And then they give them a second plate. And it's like, did they need all that? Kind of the same with our
Yeah.
dogs, you know?
Yeah, when we first got our puppy, or Annabelle, our golden retriever, she'd been on a kibble diet at the breeder, and so we kept her on that kibble diet for a period of 2 weeks or so, just because you hate to make more than one change at a time, especially
Right.
for these youngsters. And during that time, I mean, her poops were just huge, and
Hmm.
smelly, and she had mucus and this and that. And so I am a believer. You and I could talk for another hour or so just simply on diet thoughts, but I am a believer in the quality of our diet matters. And so we home cook for her. With your raw diet, some veterinarians disagree wholeheartedly on that. I would just urge caution, because your bacterial contamination is a real thing for some raw diet manufacturers, and it can kill your dog. But I think that at the end of the day, the less processed your diet is, Brittany, the less processed my diet is, the less processed our dogs are, the longer they will live. And to make a long story short, I do home cook for my dog with a combination of poultry or fish or vegetables. And as a result, I mean, her poops, and this conversation has degraded pretty quickly, hasn't it? But the reality is that, in all seriousness, her poop is probably 20% the size
Hmm.
of what her poops were when she was on kibble. Doesn't smell, no mucus. I mean, it's just. I mean, if you got to pick up poop for a living, I mean, why not make it as minimal as possible? And I would advocate for raw diets. I'd advocate for home cooked diets to do that, because I think
Yeah,
that is a
definitely.
reflection of your overall health.
Yeah, absolutely. So, Dr. Kevin, if anyone wants to find out more about you and your work, where can they find you? Website, social media, all of that.
I run a website called Helping Pets Live Longer, because that's exactly what we try to do. My little team of three, we work 7 days a week, using a combination of consults, prescription drugs, and proven supplements to do just that. I have a variety of different websites out there, amongst them Natural Pet Health, and a variety of cancer website called Pet Cancer Navigator, to help those people in the middle of nowhere who actually need a hand at 11 o'clock at night. But more than anything, just reach out to me via email. My email is drkevin@thelongevityvet.com. It's just drkevin, no period, drkevin@thelongevityvet.com. And I will help you if I can, because we're all in this together.
Dr. Kevin, thank you so much for sharing all of this information. It was helpful, and I'm sure you will be back because we have a lot to talk about.
Well, thank you, Brittany. I really appreciate the time and the knowledge that you're bringing to pet parents. I mean, this is a hugely valuable podcast, and people are lucky to have found you.
Thank you.
Bye now.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.